Welcome back to my YouTube channel. This is Dr. Nakumufaya. If you are new here, you are welcome. Thank you so much for watching my videos. Thank you for sharing. Thank you for subscribing to my YouTube channel. In today's video, we are going to talk about ectopic pregnancy. So, I don't know how many of you have heard about ectopic pregnancies before, but ectopic pregnancies are pregnancies that do not implant in the uterus. So you may be pregnant, but the baby is not inside the uterus or inside the womb, but rather the baby is outside. So the baby can either be in the tubes, which are the fallopian tubes, or in the ovaries. It can even be in the cervix or just outside in the abdomen. So what really causes ectopic pregnancies? Usually it's from scarring or damage to the fallopian tubes, um, which can happen when someone has recurrent infections in the pelvic region, which are known as pelvic inflammatory diseases that affect the fallopian tubes and the uterus. So pelvic inflammation, um, this can come about from various infections like STIs or fungal infections. All these can cause pelvic inflammation. So if you have recurrent infections, your fallopian tubes may be scarred and may be damaged, and that can lead to having an ectopic pregnancy. Um, Other causes include people who've had surgery. If you had an operation to your fallopian tubes, that might have caused some damage or some scarring to your fallopian tubes and may result in um, an ectopic pregnancy. It may cause an ectopic pregnancy. Other causes would be hormonal issues, even genetic factors, or birth defects where your fallopian tubes and your uterus are not in good shape, are not in the actual shape that they're supposed to be. So the baby can't implant in the uterus and ends up being implanted elsewhere outside the uterus. Um, so some of the risk factors include, um, like I said, infections um, from STIs, fungal infections, or any infections that affect your um, sexual organs. Also, um, putting an IUD. People who put IUDs are at risk of having ectopic pregnancies. Maternal age, if you are 35 years and above, you are at risk of having an ectopic pregnancy. History of an ectopic pregnancy in the past is a risk factor. If you had an ectopic before, you are at risk of having another one. Then smoking is a risk factor as well because it destroys the hair-like structures in your fallopian tubes that help to move the egg into the uterus. So if it's not moving, then it will just implant in the fallopian tube. So what are the signs and symptoms of an ectopic pregnancy? How would you know that you have an ectopic pregnancy? There are classical signs that people with ectopic pregnancies present with, and majority of patients will present with abdominal pain, and this is because you the baby as the baby is growing outside the uterus, it will start compressing on other structures, and so you get this abdominal pain that may be constant, and then at some point it may even become more severe, and that is when most people go to the hospital. When the pain has become more severe, that's when they go to the hospital. Then the other thing is, if the baby continues to grow and there isn't enough space for the baby to grow, it means that it might rupture because the space is not enough. So when that happens, the patient will present with bleeding, and so they might bleed so much. The other symptom, which is very important, is amenorrhea. Amenorrhea is the absence of menses. So they might come and say that I have missed my menses maybe for a month. So amenorrhea, absence of menses, abdominal pain, and vaginal bleeding. So these are the classical symptoms that patients with ectopic pregnancy will present. All ectopic pregnancies are emergency cases. So when a patient comes in the hospital or with such symptoms, it's an emergency. Whether they are bleeding or they are not bleeding, it's an emergency, because if an ectopic pregnancy has not ruptured, there is possibility that it may rupture at any time. So we treat them as emergency cases. Other symptoms that they may present with, apart from these classical symptoms, they might have dizziness, maybe because they've lost so much blood, so they'll have dizziness, syncope. They may even go into cardiac arrest or shock because they have lost so much blood. So how will the doctor know that you have an ectopic pregnancy? First of all, of course, we have to do a gravindex. Gravindex is where we check whether you are pregnant or not. And if your gravindex is positive, it means you are pregnant. The next question is, but where is the pregnancy? Is it in the uterus or is it outside the uterus? So mostly a scan, an ultrasound, will be able to tell whether the baby is in the uterus or outside the uterus. There are other tests that can be done on physical examination, of course. So checking on the stomach, is there a mass on the stomach? Can you feel something? Or is there pain, like severe pain? So all those are signs that somebody has an ectopic pregnancy. Also, they might do what is known as a codosynthesis. It's a procedure where they push a needle inside your vagina, or rather just behind your cervix, into the stomach, and then try to aspirate to remove some fluid to see if there's any fluid or if there's any blood that has spewed over into the stomach. And if that's the case, then the ectopic pregnancy has ruptured. But if it's not a ruptured ectopic pregnancy, you will not have a positive codosynthesis. So those are the main ways in which an ectopic pregnancy is diagnosed in the hospital. So like I said, all ectopic pregnancies are emergency cases, and so you will need to go for surgery as a treatment. There is only one other drug that is used to treat ectopic pregnancy, which I have not really seen being done here in Zambia. And there's a certain criteria you have to meet to be able to use that drug. First of all, the pregnancy needs to be a very small one, and it must not be ruptured. There's a certain size that it must be. If it's ruptured, definitely you are going for surgery. I have not seen it being done here, but it's an option if it's a small pregnancy. Yes, there are other criteria that a patient has to meet. They have to be in good health, no comorbidities. They have to be able to afford the medication and afford follow-up tests that come after using that medication, because you need to follow up to be able to know whether the medication is working and the pregnancy is going away or not. And if it's not working, then you might have to go for surgery either way. Those are some of the treatment options that are there. Mostly it's a surgery. Most of the patients that we have, we take them for surgery and remove the pregnancy. So what are the complications? The complications are that you may have to let go of one of your fallopian tubes, and so that also might have an effect on your future pregnancies. You might have difficulties getting pregnant next time. The other complication is that you may end up having another ectopic pregnancy, because it's a risk factor of having a second ectopic pregnancy. Usually people who have had ectopic pregnancy end up having normal pregnancies in the future, and so it's not something that you should be worried about. It's possible for you to be pregnant again and have a normal pregnancy. Then the other thing that you have to take care of is not having multiple sexual partners, because that will increase your risk of having STIs and having pelvic inflammation. And if that happens, you are increasing your risk again of having another ectopic pregnancy. So that's the end of the video. I do hope that you have learned something, and if you have any questions and you want to know more about ectopic pregnancies, you can um, let me know in the comment section below, or you can send me an email, or you can reach out to me on my social media platforms. On Facebook, I am Dr. Nakumufaya, and on Instagram is Dr. Nakumufaya. So if you have any questions, you can reach out to me and I'll be glad to answer them. Thank you so much for watching the video, and please do like the video and share with your friends, and don't forget to subscribe if you have not subscribed yet. Tell your friends to subscribe as well. I appreciate all of you. Thank you for your support. Until next time, it's bye.